Breathing, it's something we do from the moment we're born to our very last day, right? But what if I told you that this simple, automatic act, it can tell these incredibly complex stories about our health? That every single breath can be read, kind of like a book? Well, today, we're going to learn how to read it. I mean, you've been there, right? You climb a flight of stairs, or maybe you just have this lingering cough, and you get that unsettling feeling of not quite getting enough air. So, how do we get a real, concrete answer to what's going on? How can a doctor figure out what's happening deep inside your lungs? Just by measuring your breath. Well, the answer lies in this powerful diagnostic tool, Pulmonary Function Tests, or PFTs for short. Now, you can think of these as the ultimate detective's toolkit for your lungs. They're basically a series of non-invasive tests, and that just means nothing actually goes inside your body, that tell us exactly how well your lungs are doing their job. So what exactly is on this report card for your lungs? Well, it's really broken down into three main parts. First, you've got spirometry, which is all about airflow. Then there are lung volumes, which, you guessed it, measure the size. And finally, diffusion capacity, which checks how well oxygen actually gets into your bloodstream. We're going to break down each one. And what's so amazing is just how much these tests can tell us. I mean, they can diagnose a lung disease, sure, but they can also distinguish between different types of disorders, assess how severe it is, and even monitor how well a treatment is working. They're also used to evaluate if someone is fit enough for major surgery. They're absolutely crucial for making those big clinical decisions. Okay, so where do we start? How do we begin this investigation into the lungs? Well, it all kicks off with the cornerstone of PFTs, spirometry. This is almost always the first and, honestly, the most important test, and it gives us our very first major clue. And this is what it actually looks like in practice. It might seem a little intimidating, but it's really quite simple. You take the deepest breath you possibly can, and then you just blow it all out as hard and as fast as you can into this tube. And you see that technician? They're there to coach you through it to make sure you get the best, most accurate results. So, the first big number we get from this test is the forced vital capacity, or FVC. The absolute best way to think about this is to imagine your lungs are just a big air tank. The FVC, that's the total size of that tank. It's all the usable air you can forcefully push out after taking your biggest possible breath in. All right, the second key number is the FEV1. Now, if FVC is the size of your air tank, FEV1 is all about how fast you can empty it. It's specifically measuring how much air you can blast out in that very first second. And that tells us everything we need to know about the speed and quality of your airflow. But here's the real magic. It's not about these two numbers by themselves. It's about how they relate to each other. When you take the FEV1 and divide it by the FVC, you get a ratio, a percentage. And that single number, what percentage of your total lung capacity you can get out in 1 second, that is the master key. It's what unlocks a diagnosis and helps us tell the major types of lung disease apart. Okay, so spirometry gives us the speed, right? The airflow. But what about the total amount of space inside the lungs? For that, we need our next set of clues, which will give us a much more detailed map of all the volumes and capacities. Now, this wavy line might look like just a scribble, but it's actually a beautiful map of a person's breath. You see those small, regular waves there in the middle? That's just your normal, relaxed breathing, what we call your tidal volume. Then that huge peak, that's a massive breath in, and the deep valley is a full breath out. This trace lets us literally see all the different ways the lung uses its space. And here's another way to visualize it that really makes it click. You can see how the individual volumes literally stack on top of each other. See that purple bit at the bottom? That's the residual volume. It's the air that always stays in your lungs, kind of like a safety cushion to keep them from collapsing. Then you add the air you can actually use, your vital capacity, and stack it all together, and what do you get? Your total lung capacity. Okay, so we know how much air you can hold, and we know how fast you can move it. But, none of that really matters if the oxygen can't get where it needs to go, right? So the final critical piece of the puzzle is this. How efficiently does oxygen move from those tiny little air sacs into your bloodstream? That's what diffusion capacity measures. It's a test of that vital gas exchange, telling us how healthy the lung tissue itself really is. All right, team, we've gathered all our evidence. We've got the airflow speeds, we've got the lung volumes, we've got the gas exchange efficiency. Now, let's put all these clues together and crack this case once and for all. Let's identify the two main culprits in lung disease. And when we see it like this, the difference is just so clear, isn't it? On the left, with obstructive disease, the problem is that the airway itself is narrowed. It's constricted. This is purely an airflow problem. But on the right, with restrictive disease, the lung tissue itself is stiff, so it just can't expand like it should. That is a volume problem. These are two totally different mechanical issues. And this table just lays it all out perfectly. Let's start with obstructive disease. Think asthma, or COPD. Here, the big problem is getting the air out. The analogy's perfect. It's like trying to blow really hard through a tiny, narrow straw. That blockage is exactly why the PFTs show that low FEV1/FVC ratio. Now, flip to the other side, restrictive disease, like pulmonary fibrosis. The problem here is getting air in. It's like trying to inflate a small, stiff balloon that just won't stretch. And that restriction, that's why the key finding here is a smaller total lung capacity.
So we've got the numbers, we've got the patterns, and now we even have a diagnosis. But so what? What does this actually mean for a patient? Why do these tests matter so much in the real world?
Well, for a patient, these PFTs create a really clear roadmap for their care. It all starts with step 1, getting that initial specific diagnosis. Then they become this amazing tool for monitoring the disease over time, sometimes even spotting a change before the patient feels it. That helps with step 3, planning treatment and seeing, objectively, if a new therapy is actually working. And finally, they're a critical safety check, making sure a patient is strong enough for something big, like surgery.
And it is really important to remember this. As powerful as these tests are, they're still just one piece of a much bigger puzzle. PFTs tell us what's happening functionally, how the lungs are working. But they're at their most powerful when a doctor combines them with a physical exam and maybe an imaging study, like a CT scan, to get the whole, complete picture.
So, in the end, it really all comes back to this simple idea. Our breath, it tells the story of our health. It's a story about our body's resilience, its challenges, and everything that's going on inside. And pulmonary function tests, they're simply how we learn to read that story. They're the language, the alphabet that makes it all clear.